Hi and welcome back. If you're new to the channel, my name is Vince. Thanks for stopping by. You are very welcome here indeed. So the YouTube video that's titled, Can Exercise Reduce the Risk of Cancer? Peter Attia and Rhonda Patrick, that was produced by the YouTube channel Peter Attia MD, is 16 minutes and 1 second in duration. Let's break that down and let's just look at the key points. And please remember, now that I've retired, I get to watch between 20 and 30 longevity type videos every day, as well as reading articles, blogs, scientific studies, and listening to podcasts when I ruck, run and ride my bike. And I only review on this channel videos like this one that I think are going to give good longevity value. So although it is a critique of the original content, it's most certainly not a negative criticism. In this video, Dr. Peter Attia and Rhonda Patrick explore the intricate relationship between exercise and cancer prevention. They delve into how various forms of physical activity, particularly aerobic exercise, can potentially mitigate the risk of developing cancer. The discussion emphasises that while exercise is well known for its benefits to brain health and cardiovascular disease, its effects on cancer prevention are far less clear, but increasingly more supported by current data. Firstly, they look at observational studies, not clinical studies, so these may be open to some bias, and these studies looked into elite athletes. They then discussed these studies that looked into elite athletes like Olympic medalists, showing they generally have a lower mortality rate from cancer when they're compared to the general population. These athletes seem to have a lifespan extension somewhere between 5 and 6 years, particularly due to reduced cancer incidence. They then look at the role of aerobic exercise. They say that aerobic exercise, more than any other forms, and the comparison here is to strength training, appears to significantly lower the risk of certain cancers. They talk particularly about breast and colon cancer. There are others, but these two tended to stand out. They posit that the reasons might include improved insulin sensitivity and the anti-inflammatory effects of regular aerobic activity. Next, they cover mechanisms that might be at play. Here, the conversation covers how aerobic exercise might reduce cancer risk through direct mechanisms like influencing myokines, which can alter cancer cell growth factors and also have anti-inflammatory effects. Additionally, increased blood flow during vigorous exercise might help eliminate circulating tumour cells, reducing the chances of cancer metastasis. People who have circulating tumour cells are 3 times more likely to have their cancer metastasize. They then look into quantifying the exercise benefits. Here, they discuss how much exercise is deemed sufficient for cancer prevention. They discuss current recommendations which suggest the higher amounts of physical activity are associated with greater benefits in the prevention of cancer. Specifically, guidelines often recommend around 300 minutes a week of moderate intensity exercise or 150 minutes per week of vigorous intensity aerobic exercise. They say that getting to the upper limit, so more time and effort is required, may be more beneficial when it comes to reaping the benefits for cancer prevention. Rhonda Patrick also emphasises that any regular physical activity is going to be beneficial and not to focus on government numbers and use them as a way to not exercise if you don't think you're going to be able to hit them. Physical activity is also presented as a crucial strategy not only for cancer prevention but also for preventing other diseases like Alzheimer's and cardiovascular disease. Peter Attia also talks about the possible correlation between lack of exercise, obesity and the types of cancer that overweight people tend to present with.